Hello everyone, and thank you for inviting me to NHS England's 8th Unpaid Carers Conference. I'm sorry I can't be with you in Bristol today, but I didn't want to miss this opportunity to express my thanks for all your incredible work. It's great to know so many of you are coming together at a local and system level to showcase and share innovation, learning and best practice. As we know, unpaid carers play an essential role in our communities, and I want to talk about the work we're doing in government to support you. Our unpaid carers give so much to others, and I want to take a moment to thank them for the enormous contribution they make. I know many carers continue to face great challenges. Some are struggling to make ends meet, others struggle with their own physical and mental health. And some find it hard to juggle unpaid care with paid work and other commitments, let alone finding time for themselves. I know from my own family and relatives who care for loved ones just how hard it can be, the time and energy involved, the daily challenges they face. So today is an opportunity to sing carers' praises and continue to think about how we can all best support them. I know that one of the big challenges unpaid carers face is accessing professional support in their local area, which is why we're making an unprecedented investment in the social care system as a whole to support the quality and supply of care alongside targeted action for unpaid carers. One action specifically for unpaid carers is the launch of the Accelerating Reform Fund, or the ARF, which provides a total of £42.6 million to drive local innovation and scaling of projects. This fund includes our commitment to invest up to £25 million to bolster support for unpaid carers, meaning that more than half of the projects funded through the ARF, and at least one in each integrated care system area, will focus on unpaid carers. You will hear more from Sky, who have been providing hands-on support to local areas on the ARF in their session later today. But work doesn't stop there. I'm sure we all agree that identifying unpaid carers, including young and adult carers, is essential if we're to help them access support services and advice. As part of that, I know that the Department for Education's new data on young carers collected through the school census published last year is an important step towards improving visibility in the school system and enabling young carers to receive help. I'd also like to stress the vital role that GP practices play in identifying carers of any age. NHS England has provided guidance for GPs on how to do this, and I encourage GPs to make sure this is followed so that we have a better record of who is a carer. I also want to take this opportunity to reiterate how important it is to promote the involvement of patients and carers in decisions relating to the care and treatment of the person they care for. The Health and Care Act places clear duties on integrated care boards, and it's essential to embed those principles. Later this year, we'll launch a consultation on the NHS Constitution, which will look at ways to do that, and I encourage you all to participate in that exercise. For the same reason, I'm pleased to say that the steps we have taken to ensure that visiting loved ones in care homes, hospitals and hospices and accompanying them to appointments is made a priority. We know that carers often play an essential role as care supporters, providing assistance, support and advocacy for those accessing care. So we've protected visiting and accompanying by making it a Care Quality Commission fundamental standard across care homes, hospitals and hospices. This means that the restrictions that were in place in the height of the COVID-19 pandemic cannot be commonplace again. We're working with CQC to ensure that the standard is fully implemented by providers by issuing supporting guidance and holding webinars over the next few weeks. We'll also need to keep building the evidence for effective carer services. I've commissioned the National Institute for Health and Care Research to evaluate the support carers receive through the Better Care Fund. And we're also developing a new survey of unpaid carers in England, which will capture their experiences, circumstances and needs. All of this work will continue to build on the progress we have made across government to give unpaid carers the recognition and support they need, including through carers leave, a new entitlement of 1 week's leave for the purposes of providing care, which comes into force in April, and by launching a dedicated website for unpaid carers to bring advice, resources and useful information together in one place to help carers make informed decisions about combining work, care and education. So I want to leave you in no doubt that this government will continue to support unpaid carers. I won't stop championing all that carers do to support our families, friends and communities. And as we approach Carers Week, I'll be looking to convene another cross-government roundtable with NHS England colleagues so that we can keep moving forwards together. So have a good conference, celebrate and support each other, and let us know what more we can do in government to improve carers' lives. Thank you and enjoy the rest of your day.